Isn't it annoying to catch ourselves in the mirror with that double chin? Well, in this video, we're gonna talk about options, plastic surgery options to resolve it, to improve our appearance. I am Dr. Lina Triana, and I'm here to help you go through the options, surgical and non-surgical, to improve the appearance of a double chin. When we discover ourselves in the mirror with a double chin, we need to understand why it is happening. Many times it's just because genetics doesn't favor us. For example, if we have a short neck, a short bone structure of my neck. So one of the reasons why we can end up with a double chin is because we are born with a bone structure that does not favor us. For example, we can have the bone structure of the neck short and a small chin, a short chin, and that will make us more prone to a double chin. That's why you can see even people that are not old, children, and you say, he has a little bit of a double chin because of that. Or if you, for example, see your grandparents, your parents, your aunt, that they have a double chin, have a look and see the structure of the family, how the face of the family looks, and you will find those characteristics, a short neck and a short chin. That is a little bit going back. If you have that, plus you don't eat well, you can accumulate fat on the chin, and that will make you that double chin. Of course, also because the force of gravity Earth pulls everything down, the skin of the neck can also go down, and that will make me also look with a double chin. Remember that the skin of the neck, if you feel it, is a little bit thin, and that skin, that thinness of the skin does not favor that skin to be strong and push that neck back. It's easy to come down. That's why a double chin is so common in the population. Also, this epidemic of the double chin can be secondary to people always texting. Now we have these smartphones and we're always with this position down of my chin, and that favors that double chin. Unfortunately, this is here for stay because we're not testing this way. It will be strange, right? We will keep on testing down, and that will help that gravity force of planet Earth to pull everything down, and we are constantly contributing to it. And of course, as I said before, many times we have a double chin because the bone structure doesn't help us. It's genetical. So what can we do? We can help improve that double chin by putting a little bit of an implant on the chin. That can be done just with hyaluronic acid in the office, no surgery, or we can do an implant chin. That can be a solid silicone implant, or for example, cutting the bone and making it forward. So when we have that double chin, what can we do? And remember, as plastic surgeons, we go from non-surgicals to surgical options to enhance everything in your body, including your neck. So if we talk about non-surgicals, the first thing that we can see is, of course, look into if there is a small excess of fat. A fat deposit under my chin that gives me my double chin can be resolved with a machine that is called the close shaping. That means freezing the fat. With that procedure, usually one will make an improvement, but maybe we'll need 2 or 3 procedures. If there is excess skin, then maybe that will not be the best thing to do. So we can use another machine that is the focalized ultrasound. With that one, we can improve small excess of fat plus take a little bit of excess skin. With that treatment, only one treatment is enough. If we go a little bit further, when I touch the patient and I see there's more fat, then that will be an ideal candidate for a liposuction. And if we do eye liposuction, we are giving contour to the under part of my chin. As you discover through this video, it is very important to go to a specialist so that you really know what is the best treatment for you. If I feel when examining you that there's more fat deposits, then we will go for a liposuction. The liposuction, it's a pretty easy procedure. We go to the OR, 30 minutes, just a small scar here, and we will give more contour to your under part of the chin. But if there's a little bit of excess skin, we will add up in the same surgery the J plasma, meaning we will get rid of the fat with the liposuction plus do the J plasma to tighten a little bit the skin. With the J's plasma, we will have two small scars, one here and one here behind the ears. If you live outside from Colombia and want to have the procedure with us, what I recommend to those patients that come abroad to Colombia to have the procedure done is that they stay here for 8 days when a liposuction and J plasma is performed. But when there is excess skin, really a lot of excess skin, maybe the J plasma will not be enough. So when we're gonna do the surgery of the neck with a lot of excess skin, a cervicoplasty or a plasty of the neck, what we do is first we need to examine the patient, because remember, not every patient is the same. So when we decide that the patient is a good candidate for surgery because there's a lot of excess skin, what can I do? The first thing is examine the patient, because the muscle of the neck is called the platysma. It's a really thin muscle that lies really near the skin. And since in some patients that muscle is born down here near the clavicle and into the mandibular border as one whole piece, but in other patients it's two pieces. In the patients that is two pieces, you can see, for example, me, Dr. Triana, that they have a band, right? And with time, that band starts to get loose. So in those patients, just cutting the skin will not be enough. I have to suture the muscles back again to the midline so that they have, again, tension, plus taking the excess skin. So again, it's very important to examine each patient, to go to a specialist that have the knowledge, training, and experience on what they say they're gonna do so that we have the expected results. So again, if we're doing the neck, we're gonna tighten the skin. If you need the tightness of the muscle, we will do the tightness of the muscle too. And for that, we will have some scars. If we're doing the part of the muscle, we need a scar under the chin. And if we're doing the excess skin, we can have scars that can go, depending on the patient, a little bit in front of the ear or back on the ear too, depending again how much excess skin. But definitely there are some patients that come to me and say, I only want the surgery of the neck. And I see their border, their mandible border is not defined. That patient will just not look good if I only do the neck piece. I would need to do a plasty of the face, a retidoplasty, so that she really looks good. Because if not, it will be like, I don't know, like when you paint one door of the car and you don't paint the rest of the car, it just doesn't look good, right? So that's why sometimes I will do that kind of recommendation. For the patients that will do the surgery of the neck and or the surgery of the neck and the face, I recommend them for staying in Colombia at least 3 weeks after the procedure. If your double chin is bothering you, go ahead and contact us at www.drlinatriana.com. You can ask for a virtual appointment or just follow us in our social media or subscribe to our YouTube channel.